went live about, everything that we've faced this year. And for those of you who can look outside right now, we're under a tornado watch. So please be careful. It's the entire Tampa Bay area. So make sure you're very careful out there. Today, we are joined by my new co host, Dr. Edwin Michael, and we started the segment last week called The Road to Recovery. So, we'll be focusing on steps that we need to take to stay safe until COVID is under control. A lot of individuals are under the impression that the vaccine was delivered this week, therefore, we're in the clear, and that is not the case. And Dr. Michael is going to underscore that for each and every one of us. So let me give you, in case you missed last week's show, Dr. Michael grew up in India and Malaysia. He attended university in India and the UK. He obtained a PhD from Imperial College London in 1990, then went to universities of Cambridge and Oxford for postdoctoral work. He came to the US to take up a professional position in epidemiology and global health at the University of Notre Dame in 2011. Moved to USF this July from Notre Dame to take up the professor of epidemiology position at the College of Public Health. So welcome again, Dr. Michael. We are so grateful that you decided to move from Indiana. Actually, it's where my family resides, up in Indiana, and just think you could be up there in the snow right now and you're down here in a tornado. I'm not sure one's better than the other, but at least you're here now. So go ahead and give us an update on COVID and let us know what those numbers are saying.
Okay, thank you for that, Mayor. Can we see the slides?
Yes, I can.
Yeah, okay. So this is a quick update on what was presented last week, and the models have changed. The data has changed, so therefore the model predictions have also changed. And this is going forward. This is our ShearCast model forecast of daily infectious cases to the end of May 2021. The model was updated yesterday. Quickly, let me just start by looking at the insert in this graph, and that is showing the blue curves are actually cases, the daily confirmed cases as reported by the Department of Health here in Tampa Bay. These are the 4 different counties that make up Tampa Bay. And the black curve that you can see is actual model predictions. And you can see the model is really capturing the entire cause of the epidemic. So this gives us some confidence, that the model forecast might play out as the models are predicting in the future. So let's look at what the model is forecasting over the long term. And a hint here, look at the growth rate. This is a 2-week ahead predictions. The growth rate is frightening. And that is played out by what the model is forecasting over the next 5 to 6 months ahead from today onwards. The black curve is the model predictions taking into account current transmission conditions. This is the fraction of people who are observing face masks, the fraction of people who are observing physical distancing. The model is estimating that from data. And and also the fraction of people who are freely moving in the county, that we get information from GPS readings, which are supplied to us from this company called Unicast. So the black line is current social and transmission conditions. This is the forecast that the model is making. If the current transmission conditions were to be maintained, you are going to get a sizable epidemic developing. And that will peak around February 13. And at its peak, the model is predicting you're going to get about 18,000, daily infectious cases at its peak. And then the model will decay away, and then the epidemic will end towards the beyond June 2021. This is current social measures. If the social measures were to be decreased even moderately, and this is a frightening scenario with Christmas coming up, New Year festivities, those kinds of things, just by 10% of the people, refusing to comply or not complying, with social measures, look at the spike that you can expect. At its peak, you're going to get 38,000 cases, daily cases. And the peak is going to occur very soon, a month from now, more or less, on January 27th. And the green lines are showing what if we were to increase social measures, mitigation measures. Another 10%, a solid green line, another 10% of the population taking on face masks and physical distancing is going to have an impact. It's going to reduce the size of the epidemic, but not by very much.
Mm.
And what this model is saying, and this is why I said the warning, it is because of the growth rate, which the model is predicting, and is rising really fast. You can only contain it with 20% of the population, extra, fraction of the population taking to, face masks and physical distancing. So it's highly sensitive to those measures, the social distancing measures. So let me go on to, now I'm switching from cases to hospitalization, because this is a very important metric. Can our hospitals cope with the size of the coming wave? Oh, before I go, I just want to say, this is the size of the wave in the summer. Look at the size now. This is what,
Right, and we called that a spike back in July,
exactly,
and so
exactly,
it's just a mere bump compared to what you have
exactly.
predicted here. Now, one of the things that I cite, and I don't know if you know the daily count,
Mhm.
but back in one of the highest days we had back in July, I believe was about 350
Yep,
cases a day, somewhere over 300. And we've had one day just recently that we had over 900
yes,
positive cases. And
yes,
so if you're talking, now that's in Hillsborough County, clearly this is a four county area, but still
yes,
48,000 cases,
yes.
that's
Yeah. It's
unimaginable.
for the population of what, 3.1 million?
Hmm.
This is what we are expecting to see, and I think recently there was 2,000 cases across the four counties reported,
Yeah.
which is crazy. You
Yes.
and that is the blue lines that you're seeing. You're hitting 2,000 cases, so this is coming. This is not a hoax. It's coming, unless we can suppress it with social measures,
Hmm.
by seriously enforcing not enforcing, but getting people, convincing people that we have to protect ourselves.
Yeah.
The vaccines are coming, as the mayor pointed out. That is great news, and so we started simulating the impact of the vaccines as they roll out. So one feature of the vaccine is going to be a phased delivery. Initially, a low daily vaccination rate, and then step two, moving into moderate, and then high daily vaccination rate. This is going to be dictated by supply, of the vaccines, and also capacity of the county to deliver those vaccines to people. And these are the simulations. The first thing you can see is that the vaccination with those phased vaccination rates is not going to prevent the coming wave.
Yeah.
But the good thing is it'll reduce the peak, you know, requirements for, these are hospitalization cases, requirements for hospital beds. And the black, figures here is the actual model predictions, for the coming wave, um, where we have the phased introduction of vaccines. And it is predicting that with the phased introduction of vaccine, for example, if you were to release social measures by 10%, you will require 6,000 beds at its peak, which is February 7th. Compare that with 12,000 beds if you don't have the vaccine. So the vaccines are going to have a significant impact on reducing the size of the number of people who will require beds. So then, if you follow the black curve, this is with current social measures. It is predicting, with the vaccine, you'll need 4,100 beds, as opposed to 6,300 beds. If you increase social measures, you're going to decrease the demand for beds. So then the question is, what does this mean for our capacity to deal with this expected demand for beds? That depends on the number of beds that we have. We have right now nearly 10,000 beds, and how much of the beds have been occupied by other conditions. Right now, hospitals run at 75% occupancy rates, meaning you'll have about 2,500 beds which are free, to deal with COVID cases. And you can see, even with current measures, you're going to overwhelm the capacity of the hospital system here in Tampa Bay to deal with COVID cases. The only way you will decrease it is by increasing social measures, even as the vaccines are being rolled out, social measures by 20% increase in social measures. Only then you'll come under the threshold, the 2,500 bed threshold. Then the hospital systems can cope. The other thing you can see about the vaccines, you know, um, with social measures or without social measures, you will end the epidemic by the middle of April. So the vaccines are good news. It will reduce the demand for beds, and that will be improved if you bring in social measures. But it will also, is giving us a hint. The end is coming, for the pandemic.
Excellent.
And this is the final warning, what if people don't take vaccines, don't accept vaccines? This I'm showing a simulation for 50% of the people, which is what people are predicting across America, not going are going to refuse the vaccines. Look at the size of the demand for beds that will do. And that is frightening. Even with a 20% increase in social measures, that's not going to do it. You're still going to overwhelm our current capacity to deal with COVID cases. And it's also going to lengthen the resolution, the end date of the vaccines, of the pandemic. So my, quick, um, you know, um, takeaways from this modeling exercise is that we have to ramp up social measures first. And second, people have to take the vaccines. The vaccines are deemed to be safe, so far. And with the two, we will actually get rid of this pandemic once and for all.
Thank goodness,
I know.
without a doubt. Well, thank you so much for that update, Dr. Michael. That is very impactful, to say the least. So we appreciate it very much and always look forward to the information that you have. And also, just for our audience out there, what Dr. Michael said earlier is that this information is based in part on the data, on
Yeah.
the movements of the public.
Yes.
And that is tracked through the locator services
Yes.
on cell phones and things
Yeah.
that people opt into,
Yes.
with their cell phones. And
Yes. Yes.
so this is, it's information. Clearly, we can't predict with 100% accuracy, but the predictions in the past
Mhm.
have,
Yes.
have shown to be very accurate.
Yes.
And then, the predictions now, as the cases unfortunately have borne out, it looks like it's accurate now as well. But the bottom line is we can all take the simple actions that can follow that green trajectory at the bottom
Yes.
if we all just take these simple steps. And I know everybody's very frustrated and they're tired of this pandemic. Everyone is. Everybody wants to get back to the sense of normal, whatever that new normal is going to be. But we all still have to do our part to make sure that we follow that green trajectory, because the bottom line is it'll help our economy, it'll help businesses survive. Most importantly, is it'll save lives. So thank you very much, Dr. Michael, and we will talk to you soon.
Thank you. Thank you so much.
All right. Our next guests are two individuals that are no strangers to me. I talk to them on a regular basis. I always blame Dr. Lockwood. I say that it's his fault that he's given me just enough medical knowledge to make me very dangerous. But we are bringing in Dr. Kami Kim and Dr. Seetha Lakshmi. Dr. Kami Kim runs the division as a division director of infectious disease and runs TGH's COVID response and research. She is a physician scientist who joined the USF faculty in 2017 as a professor of internal medicine and professor of global health. Her laboratory focuses upon understanding parasitic diseases of global significance. Dr. Kim has worked with Plasmodium falciparum, and I should have read this ahead of time, rodent malaria to develop new malaria drug treatments and to understand malaria virulence. In addition to running her laboratory, Dr. Kim is a practicing infectious disease physician, and her work is supported by NIH. And I know that she is very active in treating, as stated, COVID patients at TGH. And also Dr. Seetha Lakshmi, she's the medical director, Tane Shea Family Global Emerging Disease Institute, and associate epidemiologist with USF Health and Tampa General Hospital's infectious disease. Uh, Dr. Lakshmi is board certified in internal medicine and also in adult infectious diseases. She's the author of numerous professional articles and has been a guest on many television programs, done several press conferences with us as well. She went to medical school in Miami at the University of Miami Miller School of Medicine, and her residency was at the Cleveland Clinic, Florida in Weston. So thank you both. I think Dr. Michael has been frozen. I don't know if you guys can see him on here, but let's go ahead and get right into the questions here. Let's start by giving us a picture of what you're seeing at TGH. I know great advances have been made in the treatment of COVID, and quite often you are sending individuals home with monitors that in the past may have had a bed in the ICU. So let's talk about the advances that have been made in the treatment of COVID at TGH and other hospitals.
Seetha, you want to take that, or do you want me to?
I can give it a first go. So with this crisis, we have learned a lot. And as the Global Emerging Disease Institute, we call it the JEDI, is essentially a culmination of all the best practices we have learned and the people on the front line who have learned how to give the best care. I think it's a true testament to the team's resilience and compassion and bravery that we have the Global Emerging Disease Institute today that is able to provide the best care for our community. There have been, multiple innovative areas that we are focused on, how we can best triage our patients, provide them the best early treatment, including the monoclonal antibody, and then many of the research trials that Dr. Kami Kim has been a part of and has been the lead. Kami, you want to talk a little bit about the research stuff as well?
So we, obviously in the beginning, we don't really know a lot about COVID. So we brought a team together, emergency room physicians, the internal medicine people, the pulmonary docs, and obviously us in infectious diseases, and reviewed the literature and sort of kept our attention on, the media and things like that. And then we also participated in many of the clinical trials and things like that, including we had early access to remdesivir. Obviously, when the studies about steroids came available, we incorporated that into our regimens. We, like everybody else, were disappointed when we found out that azithromycin and hydroxychloroquine were not helpful. We used that early on and then we stopped. And then most recently, so now for people who are quite ill, we do treat them with remdesivir and steroids. The most recent sort of tool in our armamentarium are these monoclonal antibodies to the spike protein, which is required for the virus to enter host cells. And it seems like that's most beneficial in people who are in the early phases of disease. So we've been offering that as a infusion in our, outpatient settings for people who have disease within the first week or 10 days of disease. So those are the main things that we use for treatment. Obviously, we've also gotten a lot better as far as knowing who's going to get into trouble. We have what's now called the TGH Transitional Care Clinic, but used to be called COCO, to follow patients very closely by telehealth. And those patients, when they get into trouble, can be brought back in and observed closely in the JEDI inpatient units. So we do have a lot of other studies that we're participating in. We're trying to figure out when best to use the monoclonal antibodies for prophylaxis and treatment. We're also setting up some other studies of new treatments, including immunoglobulins and things like that. So we're constantly looking for new, improved ways to treat our patients using both best clinical practice and the science that's out there.
Now, how about the convalescent plasma? Because if that is effective, then we should encourage those individuals that have recovered from COVID to provide that.
Yes, and I'm sorry, I should have brought that up. Now, convalescent plasma. I mean, this is tough because it's so it looks like all the science behind convalescent plasma. So those good antibodies in plasma, helping people clear their own viral infection, and then the antibodies being protective. The science behind that is very, very good. Unfortunately, what happened is that because people are so desperate for treatments, the trials to compare not using plasma and plasma have had problems recruiting. So we don't know as much about the beneficial effects of convalescent plasma, whether there are certain types of plasma that are better, whether certain titers are good and things like that. We do routinely incorporate that into our clinical practice because, it seems like that should be beneficial for patients. And yes, this is through the generosity of people who have recovered from COVID. They've gone to One Blood and donated plasma, and many, many of their neighbors, colleagues, friends have benefited from their generosity. And this new combined immunoglobulin therapy is going to try to standardize the batches, take plasma from many people who have donated generously, and then combine them in standardized batches that we can look to see, prove that that's helpful, but also have the doctors be pretty confident about what they're infusing, because with convalescent plasma, though we know that the person's recovered, we're not 100% sure whether that particular batch is going to be better than another one.
Right.
You're right. It's been a very important tool, and we want to thank the community for being so generous about being proactive and donating.
And encourage everyone who has had COVID and recovered to go and donate plasma, because it could be very, very helpful. So what are the possible long-term health challenges? I think the name for them are the long haulers that may be experienced by individuals with coronavirus.
Dr. Lakshmi, you want to take
Yeah,
that?
we're still learning a lot about this. I think that's kind of where some of the innovative efforts that Dr. Kami Kim pointed out, and Dr. Asa Oxner with our COCO clinic, and along with TGH, have been on the forefront of learning this. And that's what we truly need, is ability and resources to learn what the long-term consequences are. Historically, we've talked about patients who have had severe lung injury, having still that shortness of breath, not feeling like they're still back to themselves, feeling the fatigue. Some of them have noticed a decrease in able to do multi-step tasks. So there are still many things we need to study, but it seems like certain patterns are starting to emerge. Kami?
So I think, this is still early on in the epidemic. And so I think probably most of you have heard the beginning phase is the viral phase, and the treatments that we have, remdesivir and the monoclonal antibodies, hit that phase. And then the people who get into trouble seem to have inflammation, particularly in their lungs, but in many parts of their body that we don't quite understand well. Some of it may be proportional to this receptor that the virus recognizes, the ACE2, but it can't explain all of it. So you've heard of people who have, cognitive problems. Clearly, a lot of people have lung problems breathing, poor exercise tolerance. There's some evidence of, kidney problems and heart problems. Many of those effects do resolve with time. And what we're not certain of is if there will be long-term, going out many, many months or even years for a significant fraction of these people. And also, if we can figure out what is causing these long-term effects, obviously we would be, really thrilled to offer treatments for these people. And also, if we could identify who was going to get into those kinds of problems early on, then obviously we would like to institute therapy as early as possible. So those are actually another area of research that we're actively participating in, and we hope to know more soon.
I
That's so I saw something the other day where an individual had it recovered, was in the hospital, very severe case, and felt that they had recovered, went out, came back, and literally had paralysis. And also with the loss of smell and taste, doesn't isn't that indicative of some neurological effect? So have you heard of that as well? Cases where individuals um, suffered a degree of paralysis.
Yes, and that's probably one of the alarming things. And when we talk about young people being okay, I think that's something we need to take into account. Dr. Michael just posted in the chat as well, is that we don't truly understand the whole extent of the long-term consequences, even in young people. And then the second thing is that, especially the life-changing events that this could be in terms of damage in the brain, like stroke in young people, and then the stuff you mentioned, it appears that some of the structures around the nerve cells are the ones that really bear the brunt of the damage, but we still are learning and figuring out what really is causing this. And that's especially, I think, the warning for young folks that feel like, it's not going to be a bad disease. We don't fully understand the full spectrum.
So let's talk about this. I know I was on a panel with Dr. Kim, and we talked about it too. So you have individuals that can be asymptomatic, and then you have individuals that, it may be the same physical condition, same age, same, and they're in ICU with it. And so one of the things, Dr. Kim, that you said, that again, a lot of unknown, and I don't know if you've learned more since we were on the panel, but part of it could be dependent on your blood type. Part of it could be dependent on your immune system, the strength of that. And then part of it could be that the dose that you receive, whether it's a severe reaction or not. So have we made any headway in that, or are we still pretty much in that unknown phase?
Well, I think that all of those sort of trends are still being borne out. I think one thing, there's clearly something related to dose. So you probably remember from China, there were a lot of really, healthy healthcare workers that died and had very, very bad outcomes. And that's still happening, but it's not happening as much. And I think that probably has to do with inoculum, in that we now know to be safe. And so we've had, we occasionally do have work associated infections and things like that. But because people are wearing PPE, they know to wash their hands, they know to shield themselves and things like that. I think the dose they get, even if they're unlucky to get a case at work, it's not that huge blast of virus. So people that, our colleagues who seem to have a work-related exposure, they don't seem to be getting as severe disease and things like that. So I think that part is clearly true. But I think there's also, we know about all the risk factors, people who, who are heavy, people have diabetes, have high blood pressure, the elderly, they definitely tend to do the worst. But we all, those of us who've taken care of a lot of COVID patients, we've seen the, 30-year-old runner who may have recovered but was in the ICU for 2 months, or people who are 40 and didn't really have any medical problems who died and things like that. So I think though all those people with chronic medical conditions and the elderly are at greater risk, I don't think that anyone can really say, oh, just because I'm 25 it'll be fine. And I think that's the message that many people sort of misunderstand, because the effects are so tragic and dramatic in people with other medical conditions and in the elderly.
Yeah. And that's a message to the young people. Just because you're young and healthy doesn't mean that this disease won't affect you. And then also the risk of taking that back home to somebody who can't afford to have it because of comorbidities. So let's talk about the vaccine. So we have Pfizer vaccine that arrived on Monday at TGH, and then that is going to frontline healthcare workers, and then to the ALFs and elderly, correct? And that's going to be distributed by CVS and Walgreens to all of the elderly facilities in Pinellas and Hillsborough.
So yeah,
Okay.
to go ahead, since you've been more involved in the
Okay.
planning of all these things.
Yes, so I first want to preface the little bit of the conversations around what this mRNA Pfizer vaccine is, because I think there is a lot of questions, and understandably so, because it's new. It's hopeful and exciting, but also we have to answer some of the questions. So the analogy I have in my mind for the mRNA vaccine is like a mailman. So if the mailman comes and drops off the vaccine at your mailman comes and drops off the letter at your home, and then he leaves, right? So the mailman doesn't stay in your house. The same thing with the messenger RNA concept. The messenger RNA is like a delivery mechanism. It comes, drops off the information, and then lets your body make what sense it has to make of it. And it's very specific. The mail contains very specific information about the virus. It does not contain the entire virus. So you don't get COVID-19 from the vaccine itself. And right now, because we have such limited supply of the vaccine, the hope is that we get it to the frontline healthcare workers, and we take the lessons learned along with the nursing home and the vulnerable population in long-term care facilities. We take the lessons learned, and we are more efficient in how we are able to reach everybody through this vaccination campaign.
Now, the next is going to be the Moderna, and hopefully we'll get the emergency use agreement on that either tomorrow or Friday, and then looking at rolling that out for those frontline workers, first responders, and then start going into those that may have high risk, or those with the comorbidities. Now, it's a 2-shot vaccine, and it's important that if you get the first, you need to get the second. I know that one of our political leaders sort of indicated that maybe all you need is 1 shot of this. So what's the efficacy? I've heard anywhere the first shot from 50% effective to 85% effective, but I don't know that that there's an exact percentage on that. And then what are your thoughts on the second shot?
Sorry for interrupting. I don't think there's enough data. What was very exciting, if you're a scientist, so there are 2 shots. So there's the initial shot, and then there's the booster shot, which, depending on the platform, is either 3 or 4 weeks after the initial shot. And so the immunology is, probably too much detail, but the idea is you have exposure to that spike protein antigen, and then you give what's the booster, which is the reminder to your immune system that this is really important, don't forget it. So I think for the strength and duration of the immune response, it's important to have both shots. What was very exciting for us, if you look at the data, is that these were placebo-blind studies. So in other words, one group got something that was a shot but not vaccine, and the other group got vaccine, and then you basically counted symptomatic cases, and you could see the difference in the symptomatic cases happening within a week or so of people getting vaccinated, suggesting that the first shot made a difference. But so that's phenomenally exciting, because it means that even 1 shot will afford some degree of protection. And so that's part of the reason many of us are very, very excited. But that doesn't change the other parts of the great science, which you want to have the most bang for your buck and the most protection, which means that you want to get both shots, and you want, the whole 95% effective thing, which was the 2 shots and the protection after 2 shots. So I think it's great that 1 shot has some protection, but I would still go out and get my 2 shots, and not for people who are, in wherever you are in line, don't forget about that second shot. It's really, really important.
There you go. Now, do you know offhand, and this is random question, if both of those doses would be the same? The first shot vaccination you get and the second vaccination, are they same, or is the second one a little diluted?
It's the same.
It's the same. Okay, excellent. All right, let's talk about
in these, at least in these. I think other vaccine, there's many vaccines being developed. So, but for these particular ones, it's the same.
Okay. Now let's talk about anticipated side effects of these initial vaccinations, because that's a concern to a lot of people as well. So what do you know about the side effects of the vaccination?
So I can start off, Kami. I can speak from two fronts. One, that what we have seen in the studies and in the emergency use authorization, and then having received the vaccine, a little bit of what I felt. So the first piece of it is that in the emergency use authorization and in the data itself, which Kami can speak more to of, is that yes, there were side effects. And most people felt the side effects were pain at the site of injection and some body aches and low-grade fever, which are considered mild side effects. Now, after the second dose, more people had side effects, again, same kind of side effects, but much more intense. So those 2 points, I think, are important to understand in the context of when we talk about safety and side effects, right? You're looking at mild to moderate side effects, which kind of similar to what we experience with influenza vaccine, but a little bit more in the second dose, where you have to expect that. So employers, who have a task of looking at how their employees get vaccinated, might have to think about staggering some shifts, accounting for absenteeism and stuff like that. So you take into account the reactions. And the second piece of it, I was fortunate enough to get the vaccine through the program for healthcare workers, and had, as expected, had some pain in the arm. So it was good to take Tylenol at night, so the pain in the arm didn't bother me. Had some low-grade fevers, but that was 2 days ago, and I'm perfectly fine today. No other problems at all.
Okay, and that's something we've discussed as well. Looking at our first responders, our frontline workers, is that do you administer when they're on their days off, in case there are side effects, and that's something to take into consideration as well. Let's just real quickly, if you have any, just to sort of put people's apprehension, sort of deal with that and put people at ease. What did the trials look like? How many people were involved in the trials for both the Pfizer and the Moderna vaccines?
So they were both aiming for about 30,000. And actually the Pfizer ended up having over 40,000 because they initially, they ramped this up very quickly, and they worked with centers that were used to doing vaccines and things like that. And then midway through, they realized that the demographics of the people that they were most worried about were not well represented. So we know from other vaccine studies that maybe, say, African Americans, it might only be 1 or 2%. And obviously, one of the real tragedies about all of this is that communities of color are more affected. So they basically took a step back and said, we have to recruit more individuals, increase their amount of patients to over, I think it was 42 or 44,000, and specifically recruited a lot of these groups. So they had close to 10% African American. They had a lot of Hispanics. They made sure they had a lot of, elderly people. And what was remarkable about the study is overall the efficacy was close to 95%. But in all of those groups, they did have enough people to say that even in all those groups that they were worried about, the efficacy was still about, over 90%. And so similar things as far as the Moderna. So, and also what's also reassuring about these vaccines is, these are fierce competitors. They had a similar platform. So the Pfizer is a little bit different. It's more cold sensitive. The Moderna is a little less cold sensitive, but the principle is the same, but they did it independently. And they pretty much got the same results. So, I think if you speak to scientists, you've probably seen Dr. Fauci, like so much more wildly successful than any of us would ever have hoped. and you see some protection after the first dose. And the side effects, as Dr. Lakshmi said, are most of the ones that you would predict.
Mhm.
So fever, a sore muscle. That's all stuff that that's not great, but that's something that we can deal with. I mean, what we're worried about, we're worried about the more serious side effects.
Mhm.
And part of the reason they waited 2 months is most of the sort of the immunity side effects that we know of, they tend to show up within about 6 weeks. Not everything shows up, but so that's why they waited the whole 2 months to see. And so far, pretty much what they've seen in these studies, which are pretty big, are side effects that we sort of know how to deal with. Even this anaphylaxis that people are worried about, of course, that's scary, but doctors know how to deal with anaphylaxis. So we're being careful. So we're, doing the rollout, and sort of people who might have those kind of reactions, we're probably going to wait a little bit just to make sure. But, this is something that we know what to do about. So far, the side effects have not been anything that medical personnel know about and can deal with.
And that's excellent. We had, and that's one of the questions from the media, is referencing, minority communities and African American Black communities. There is a well-earned mistrust of vaccines with some of the things that have been done in this country in the past. And so I had Dr. Sneed, which I know you all know, who heads pharmacy for USF, and Dr. Hill, who's also a professor at USF, both of which African American, and they talked last week about on this particular show about the safety of the vaccine and how they had included a large percentage, as you said in the past, you would have 1 or 2% minority in these trials, and that they had 10% or better. So they were very happy with that and very, very supportive of the vaccine, and also have done throughout the Tampa Bay area, gone to churches, all types of locations and platforms where they can go and answer questions, concerns of minority communities about this vaccine, hoping that we'll be able to get people to opt in to taking this. So, because as we know, this virus has disproportionately affected Black and brown communities, and it's very important that people feel that comfort in taking this vaccine. So we talked about the anticipated, recent clinical trials. No long-term side effects so far from the vaccines.
As far as we can tell, yes.
Excellent. That's good. And then once the vaccinations begin to occur, which we already have, this is a good one. Does that signal the end of having to wear masks and physical distancing? That's what everybody thinks, and I know the answer is no.
I only wish is
Yes.
the answer. Dr. Lakshmi, you can answer that question.
Yes. So I think this is a thing about hope and how we want to respond. And the way I look at it, at least I tell myself and my team on the front lines, that we can see the shore. The home stretch is here, but we can't stop swimming at this point. And think about everything we have done, come together and manage to stay together and fight this. And at the home stretch, we can't give up. So at least that's how I think about it for myself and the team. And it's crucial because we know how to give the best care we can, but if the amount of cases keep coming up, like Dr. Michael showed, we don't have frontline anymore. The frontline is the community, because the healthcare workers talk about pandemic tiredness. They are tired. And if we go in the route of what Dr. Michael is showing, it's going to be really, really hard to be able to provide care for our community and patients. So I really want to emphasize this point that yes, the shore is in line. We can see it. The cavalry is coming. Rescue is in hand, but we can't stop right now. That means, including the fact that one of my colleagues says often that it's not the vaccine that ends the pandemic, it's a good vaccine program. And what is a vaccine program? It's good delivery, but also wearing the mask, distancing, everything we know how to do. And that's how we can bring it to closure. That if we don't do those essential things, we won't be rescued. We won't be rescued through this pandemic.
Yes, without a doubt. Thank you for saying that. And that goes, whoever is watching this show right now, please, please, please pass this on to everyone you know. If you're a parent and your kids are home from college, please pass it on to them because they can't feel free to go out, hang out with their friends without any masks, without any social distancing. We're still in that home stretch, as Dr. Lakshmi said. And the last thing we can do is overwhelm our hospitals. You know, the men and women on the front lines have been there working tirelessly, and it's the worst thing that we can do is overwhelm them. Someone said something, described themselves, it was an emergency room nurse, and said, don't look at us as your first line of defense, look at us as your last chance of survival. So, we can't be overwhelming the healthcare workers. Okay, let's see. Um, the other question was, has there been any talk on the municipal level or between local hospitals regarding how it's going to prioritize communities of color and economically disadvantaged communities who may have trouble with resources to get the vaccine? That is something that we are talking about, and we have been talking about that throughout with the testing. We have a testing site, our two main testing sites, one in East Tampa, one in West Tampa, one at Lee Davis Center over on 22nd Street, and another one over at Raymond James Stadium in West Tampa. And so we definitely have been discussing the testing portion of it, and also the informational, getting the minority communities comfortable with taking this vaccine. That's the first step. Second step is ensuring that we get it to them. And we are going to take every step that we possibly can to ensure that we're getting everybody vaccinated. And as I said before, we have Dr. Sneed, Dr. Hill. We can replay all of our Facebook Lives, I believe, are on YouTube. And then anyone that wants to have Dr. Sneed, Dr. Hill come out and talk to their particular group, their community, their church, I know that they're more than willing to do that. Here's a question. Has Mayor Castor spoken to Governor Desantis about vaccine distribution? No, I have not. If not, has she spoken with anyone, the administration, about the rollout? I talked to the emergency manager, Jared Moskowitz, emergency manager for the state of Florida, on a regular basis, but mostly about the vaccination rollout has been on the local level, about how we are preparing to administer that, who has the certain responsibilities, when the vaccine's coming in, the stages for the distribution of that. And we're very lucky to live in the Tampa Bay area because everyone works very closely together. All the hospitals are working together, first responders, and all of the leadership in each particular jurisdictional area. So we are definitely have the plan, and we are ready. We've exercised it, and we are ready to put it in action as soon as we get the next batch, the Moderna batch. All right, here's another one. Can you ask both the mayor and Dr. Lakshmi to react to the NFL's plan to invite vaccinated healthcare workers to the Super Bowl to honor them? So clearly it sounds like, Dr. Lakshmi, you may be down on the field for Super Bowl since you got the vaccine. I think that's wonderful. That was an announcement that was made today from the commissioner of the NHL, Roger Goodell, and that was something that they wanted to do. You know, there's going to be a limited number of fans at Raymond James Stadium to watch the Tampa Bay Buccaneers play in the Super Bowl against whatever team shows up to play them. So I think that would be wonderful. What a great tribute to bring in healthcare workers, those individuals that have been working on the front lines that have taken the vaccination. So I don't know if either of you have heard about that. And if you have, you're more than welcome to comment on that. But I think that's a wonderful idea. Did you hear about that, Dr. Lakshmi?
No,
I know that you're.
the first
It was
time.
so funny to hear that your hobby is restoring antique cars. Is that correct? Like you have time to
That's
do it?
guilty by association. That's my husband, and then he got me addicted into it.
That's good.
Yeah, no, it is fun. It's good nostalgia and things to remember from the past. But no, that's be wonderful news. I'm sure many of the frontline workers, it'll be a great thing to look forward to.
Yes.
Again, depending that we all have get vaccinated and don't have the concerns for transmission, which again is not proven yet. So we have to wait a little bit.
Yeah, we have to make sure that we that we get as many people as we can vaccinated as quickly as we can, but it doesn't remove the responsibility of each and every one of us to ensure that not only are we keeping ourselves safe and healthy, but we're keeping those around us safe and healthy. And these, as I've described it, we're really looking at a California wildfire right now, and we're going to fight to save as many houses as we can, but we need the community's help in that. And on that note, we are having a press conference tomorrow with a number of the jurisdictions in the Tampa Bay area to talk about enforcement efforts to those businesses that are blatantly violating the mask ordinance and the other ordinances that have been put into place to try to reduce the number of COVID cases. So we will be doing that tomorrow. Thank you, Dr. Lakshmi, as always. Thank you, Dr. Kim, as always. It's always wonderful for you to impart your knowledge and experience with the community. And I'm very, very thankful that both of you answer my phone calls when I call. So thank you for all you do for our community, for keeping us safe. And we will see you quickly. Remember that here in the city of Tampa, we have handed out over 500,000 face masks. We have about 400,000 people in the city of Tampa, and we've already passed out 500,000 face masks. We intend to pass those out as we are enforcing the mask ordinance at some locations this weekend. So again, if you're young, you plan on going out to the bars with your friends, just stay home. And we know our businesses are suffering, but we will get back on our feet economically much, much quicker if we all do our part to wear a mask and socially distance. We also have some guerrilla marketing campaigns out there about choosing your mask, whether you want to wear a mask for safety or you end up wearing a ventilator mask. So that's a little graphic. We have our Happy at Home TPA campaign. You can go to tampagov.net and see all kinds of interesting PSAs. We have all of the sports teams involved with a get in the game theme, encouraging mask wearing, and just all kinds of things to try to get you involved in wearing masks and staying healthy. So thank you all very much for joining today. Please don't forget to join next week as well for Facebook Live. And remember to stay safe, stay healthy. We have a lot of choices. Please choose to be kind. We want to make kindness more contagious than COVID-19. Thank you all, and God bless.